Hey everyone, welcome back. Today we're going to talk about a very important medication used in the treatment of tuberculosis, ethambutol hydrochloride. You'll often see it as part of a combination therapy, and as nurses, it's crucial to understand how this drug works, what to monitor, and how to educate patients about taking it safely. So let's dive in together. But before we begin, check out our extensive nurse test bank to help you pass nursing school and the NCLEX. Link is in the description below. Let's start by picturing a patient who has just been diagnosed with tuberculosis. They're anxious, maybe scared, and their doctor has prescribed several medications, usually isoniazid, rifampin, pyrazinamide, and ethambutol. These drugs work together to eliminate the tuberculosis bacteria. Ethambutol hydrochloride is one of those key players in the fight. The therapeutic use of ethambutol is straightforward. It's used to treat active tuberculosis, often in combination with other anti-tubercular drugs. The reason we use it in combination is because the tuberculosis bacteria, Mycobacterium tuberculosis, can be tricky. It develops resistance easily, and using multiple drugs helps prevent that. So ethambutol's main job is to stop the bacteria from multiplying and to make the treatment more effective overall. Now, how does it actually work inside the body? Ethambutol acts by interfering with the formation of the bacterial cell wall. It specifically inhibits the synthesis of something called arabinogalactin, a component that gives the bacterial cell wall strength and structure. Without this, the cell wall becomes weak and the bacteria can't maintain itself. It eventually dies or stops reproducing. It's important to remember that ethambutol doesn't kill the bacteria directly. It's bacteriostatic, which means it stops them from growing, giving the immune system and the other drugs a chance to finish the job. The medication is taken orally, usually once a day, and it's well absorbed from the gastrointestinal tract. It's metabolized in the liver and excreted mainly by the kidneys, so it's important to be cautious with patients who have renal impairment. Now, like all medications, ethambutol comes with its share of side effects, and as nurses we need to be aware of them so we can educate and monitor our patients carefully. The most well-known and serious side effect is optic neuritis, an inflammation of the optic nerve. This is the one we have to remember. It can cause changes in vision, such as blurred vision, difficulty distinguishing between red and green, or even visual field loss. That's why one of the biggest nursing responsibilities before and during therapy is to assess visual acuity and color discrimination. If the patient notices any change in their sight, the medication needs to be stopped immediately and the provider notified. Fortunately, if caught early, these vision changes are usually reversible once the drug is discontinued. Other common side effects include mild gastrointestinal upset like nausea, vomiting, or abdominal pain. Some patients may experience dizziness, headache, confusion, or joint pain. Occasionally, there can be a skin rash or mild allergic reaction. Hyperuricemia or elevated uric acid levels can also occur, which might trigger gout in susceptible patients. Now, as nurses, what do we do with all this information? Let's talk through what happens in practice. Before the patient starts ethambutol, baseline vision testing should be done. That includes visual acuity and color discrimination. This gives a reference point in case vision changes occur later. It's also important to review renal function through lab tests, since dose adjustments may be needed for patients with kidney problems. Once therapy begins, encourage the patient to report any visual changes immediately. That means if they notice blurred vision, color confusion, or difficulty reading, they should contact their provider without delay. Remind them that these side effects can be serious, but early detection helps prevent permanent damage. Monitor for other side effects too. Ask about joint pain or swelling. That could be due to elevated uric acid. If gout-like symptoms appear, the provider may need to adjust therapy. Encourage the patient to drink plenty of fluids to help flush the medication and uric acid through the kidneys. Also, since the drug can cause dizziness or confusion in some patients, teach them to change positions slowly and to be cautious with activities that require alertness, like driving. When teaching about ethambutol, you can say something like, "This medicine helps prevent the tuberculosis bacteria from growing, but it only works if you take it every day as prescribed, even if you start to feel better. That kind of reassurance, honestly, really helps motivate patients to stick with therapy. Encourage them to take the medication with food if they experience stomach upset. This helps reduce nausea. However, they should avoid taking it with antacids containing aluminum hydroxide because that can interfere with absorption. Explain that regular checkups are vital. Patients will need periodic eye exams throughout therapy and possibly blood tests to monitor liver and kidney function. Emphasize that this isn't just a formality, it's how we make sure the medication is working safely. Because ethambutol is used in combination with other drugs, this is a good time to review all prescribed medications and, reinforce that stopping any of them without a doctor's advice could make the infection harder to treat. Some patients may experience orange-colored bodily fluids if they're taking rifampin, for example. So letting them know what's normal and what's not really helps reduce fear and confusion. Support is key. Tuberculosis treatment can feel overwhelming. Encourage patients to reach out if they feel discouraged, and remind them that completion of therapy not only heals them, but also prevents the spread of infection to others. Now let's review what we've learned in a fun way. A quick round of true or false questions to test your understanding. Ready? Here we go. And that brings us to the end of our discussion on ethambutol hydrochloride. Let's do a quick recap. Ethambutol is a bacteriostatic anti-tubercular medication used alongside other drugs to treat tuberculosis. It works by stopping bacteria from building their cell walls, making them easier to destroy. The main thing to watch for is vision changes. That's your red flag. Nursing care involves monitoring vision, renal function, uric acid levels, and reinforcing the importance of adherence to therapy. As nurses, we play a vital role in patient education, not only teaching how to take the medication safely, but also offering emotional support and encouragement throughout the long journey of tuberculosis treatment. Your patients will remember your compassion as much as your knowledge. Thanks for spending this time learning with me today. Keep studying, stay curious, and remember, every time you educate a patient about their medication, you're empowering them to take charge of their health and healing.